Good afternoon, everyone. I'm Tammy Epps. I'm the Director of Media Relations and Social Media here at Prisma Health. And today we're here for kind of a solemn reason. Many of you were watching the football game last night and saw the devastating hit that was taken last night by Damar Hamlin. Many of us were watching it live. And if you weren't watching it live, you might have saw it on the national news this morning. Many of us have watched it many times, unfortunately. So first of all, we want to start with saying that we send our condolences out. The Prisma Health family sends our condolences out to Damar Hamlin, his family, the entire Buffalo Bills team, and all of the NFL fans all over. We all were watching something pretty dramatic. We've taken the time today to put together some of the Prisma Health experts to bring to you some conversation about this devastating hit that this player took. First of all, we'd like to say that this is general conversation and speculation based on our experts, the things that they have done and seen, and it is not related to the specific incident because none of them were involved in that specific incident, but many of them have been involved in many other things. So with that, I'm going to tell you all of our experts, and I'm actually going to let them give their own title once they get on. But we have Dr. Michael Cryer, who's one of our cardiologists for Prisma Health. We have Dr. Zoe Foster, who's a medical director of the University of South Carolina Athletics. We have Dr. Jeffrey Guy, who's an orthopedic surgeon and a team physician for USC for more than 20 years. And we have Dr. Peter Loper, who's a pediatric and adolescent psychiatrist. So we're gonna start with Dr. Cryer and let him kind of talk about what we saw, the hit, and just kind of on the cardiology side. We'll go through a few, and all of our experts have a chat, and then we'll see what questions you might have. We wanna thank our media partners for joining with us today in this solemn conversation. And with that, I'll highlight Dr. Cryer.
Thank you, Tammy. First off, just want to say I'm sorry that Mr. Hamlin and his loved ones are having to go through this right now. This is certainly a very difficult time for them. I was able to see some of the videos from the incident last night and watch some of the broadcast after the event. And, what's striking to me is it looked like a regular football play. It was a tackle, albeit there was some contact to the center of the chest, but nothing egregious. Did not appear to be any injury to the head that was at least, that could be observed on the video that I saw. And then obviously the dramatic event of him collapsing and then the subsequent events afterwards. I wish him the best and I really, hope for the best that he can pull through. The best thing about all this and this terrible thing is that there was immediate medical attention brought to him and early recognition of his difficulties, his loss of pulse and difficulty with his breathing and airway. We know patients who have out of hospital arrests, the ones that do the best and show a great prognosis for recovery are those who have early resuscitation efforts. And we witnessed that last night. In addition to that, he has a good, reserve. He's a young, healthy guy, he's an athlete and the top level. So he has that going for himself. There certainly are some things, at least as a cardiologist, that I wonder about, that could have happened. That hit to the chest did not look egregious, but, at the right area of the chest at the wrong time can sometimes spark something called ventricular tachycardia or ventricular fibrillation. There's an entity called commotio cordis. I'm sure those who have done some Googling and internet review may have come across this, but this is classically a condition that we see in kids, when they're hit to the chest, and most notoriously with, say, a baseball or a tennis ball. Luckily, most of the time this is self-limited and either with early resuscitation efforts or spontaneously will go back into normal rhythm. There's a host of other things this could be, and the list is quite long, but something like that certainly comes to mind. Other common entities from a cardiac perspective we see on the field are hypertrophic cardiomyopathy, thickening of the heart muscle that can largely is genetic and lead to abnormal heart rhythms or an increased risk for these abnormal heart rhythms, such as ventricular tachycardia and ventricular fibrillation. There's also undiagnosed cardiomyopathies, such as weakened heart muscle or heart failure. Sometimes high level athletes can develop some degree of this and be, have irritable heart muscle and be at a risk for this. It's important to note, I mentioned these terms a couple of times, but the ventricular tachycardia and ventricular fibrillation are, entities that cause sudden cardiac death and cardiac arrest, and certainly would be high up on the list of concern for something he may have had.
Thank you, Dr. Cryer. With that, we'll go to Dr. Foster, who is the medical director of the University of South Carolina Athletics, and she can add some thoughts. Dr. Cryer, will you give your full title for us? I forgot to ask you to do that.
Yeah, absolutely. Dr. Michael Cryer with Prisma Health. I do interventional structural cardiology. Yeah.
All right, Dr. Foster. Dr. Foster, of course, as the medical director of the University of South Carolina Athletics, I wanted to see what thoughts you might want to add to Dr. Cryer's.
Yeah, thank you, Tammy, for having me. I appreciate the opportunity to speak today. And as you said, and Dr. Cryer also said, our thoughts are certainly with Mr. Hamlin and his family and team at this time. I think what I'd like to stress, and Dr. Cryer certainly touched on this, is the fact that whenever we are on the sidelines at games taking care of patients, preparedness is always on the top of our mind. We certainly hope that something like this never ever happens, but this is unfortunately something that we do plan and prepare for, because as Dr. Cryer said, certainly in these situations, time is of the essence in helping somebody have a good outcome. Here at the University of South Carolina, our coaches are CPR trained, so they are able to respond if something like this were to happen to one of our student athletes in an emergency. We also have athletic trainers who are CPR trained, and again, able to respond if such an event were to happen. All of our events and venues have what we call an emergency action plan in place. This spells out for our staff, for our coaches, where we keep the AED so that people know where to find it in case of an emergency. It tells our staff where to meet EMS if an ambulance isn't on site at one of our games. Now, certainly in Gamecock football, we do have an ambulance on site. And what we do is we practice this emergency action plan at least annually, because we know with practice that we're going to respond better, that we're going to have better access for our emergency equipment. Say, as you saw last night, the ambulance actually coming onto the field, because by practicing it, we know we can respond competently and quickly to some sort of emergency like this. At Gamecock football, we also have an arrangement with one of our specialists who helps us if we were to need it with airway management and with managing medications for cardiac crises such as this. So I hope and pray that we don't ever have to deal with anything like this, but I'd certainly like to reassure our fans that we are prepared and do practice if, heaven forbid, we were to be faced with this type of situation.
Thank you, Dr. Foster. With that, I'll go to Dr. Guy.
Hey
Dr.
guys.
Guy.
Hello,
Go ahead.
good morning. Everything Dr. Foster said, I think is right on. It's again, we all feel for the family, and I happened to be watching last night, so I saw the whole thing happen, and it's one of the scary sides of being a team physician, and that's why I think as a team we practice these scenarios, and our athletic training staff, and we meet once a year, and spine boarding, ABC, CPR. I mean, we talk about these things. Some of the things that I thought was to add what Dr. Foster said. I think if you look at what happened yesterday, there was immediate team-wide, both teams, the colors go off. When somebody goes down, both sides, both athletic training staffs, physicians, the covering doctors that may not be affiliated with the teams, ambulance, you see how quickly the ambulance got out there. That's all pre-prepared. I mean, that's the communication. That's why we have microphones on at the sidelines for football, and that's why we communicate. It's communication is a key for this whole thing. It's preparing, communicating, and this is probably the worst type of scenario that we see, where somebody's heart stops. And that's it. You kick into the ABCs, the airway, breathing, circulation, and that's what we're all trained for. But trying to get somebody taken care of as quickly and fast as possible, can be life or death, make decisions that are life or death. So the immediacy that you saw everything happening was pretty impressive. And that's for, we meet before games, as they do in the pros, and we have a timeout. We meet with let the opposite team, the visiting team, know where everything is, who's on their sidelines. The sidelines, we have athletic trainers typically that are people who are available for the visiting team if they have any medical problems, so that we can assist them getting them taken care of, whether it's x-ray or more emergent things. But these things fortunately don't happen often, but you have to be prepared for them. So it's scary, and this is certainly something that we all prepare for, but we hope never happens.
Dr. God, thank you. I know that Prisma Health is the official team physicians for both USC and Clemson, but aren't there some others that were also team physicians for? Lots of others, right?
So Prisma Health is probably our group within Prisma Health here in the Midlands. We care for all 8 colleges in the area, but also somewhere in the upper 30-40 high school range. And one of the things that we try to do with Prisma Health is try to give our smaller colleges and our high schools the same level of care. It all varies to different circumstances, but the trying to get people taken care of as fast as possible, get them in the system and safely back in the field. We have athletic trainers, we have team physicians, our residents, and people in training, all at these different sites. We also cover the 2 ballets in town, some of the professional soccer teams. And so, that's one of the things we try to do with Prisma, is try to give everybody else the same level of care, or certainly the attempt to give them the same level of care as you can with our USC teams. Now, the one thing that makes sure is everybody doesn't necessarily have an ambulance. There's level of contact and collision sports that we try to have those things available for, because the risk is a little bit higher. But trying to get people into the system is part of what Prisma Health is promoting, and that's what we've been doing for years.
Thank you. With that, I'm going to go to Dr. Loper. Dr. Loper, we were all watching the game, live. Dr. Loper is a pediatric and adolescent psychiatrist. And I think the thing that we also thought of today is not only were we watching it live, but then we watched it unfold live. We watched him being carted off. We watched all the people, all the effects. So can you talk as a psychiatrist about how that impacts us and what we should do about it?
Yeah, sure, absolutely. So first and foremost, thoughts and prayers to the Hamlin family. I just want to acknowledge his experience and acknowledge the experience of his family and his teammates right now. Can't imagine how difficult this is. So I had real-time experience with this last night. I have 4 kids. My 2 little ones are really into football. They had school today, and so they had to go to bed a little bit early last night. They were not allowed to watch the game, but they wanted to check the score right before bed. So of course I pull up the ESPN app and I'm looking at the score, and it says the game has been delayed. And the first thought I had was, what kind of weather could possibly be occurring this time of year that would cause a game delay? And then as I read further, my heart dropped. And of course I'm reading it real time and processing it real time with my 2 boys. One is 9 and one is 7. So in these types of circumstances, there is a tendency for any kind of tragic event like this to be experienced collectively. Think about the millions of viewers who are observing this real time and watch Mr. Hamlin fall to the ground, and then the aftermath and the sequela. And so that in mind, one of the most important things we can do, there's 3 specific steps. The first thing that you want to do in a situation like this to ensure your mental health and well-being moving forward, and to ensure that you're respectful of the Hamlin family and their privacy, is going to be, you want to prevent. So you want to prevent re-exposure to the event. Now that's really, really difficult to do, especially if you have teenagers. Obviously the play and then the sequela is all over social media. The news cycle is real, and I understand that this is a press conference, but one of the most important things you can do is prevent re-exposure to the actual event. And what that does is it redirects our attention from things that are outside of our locus of control and it decreases and mitigates some of that distress in that collective traumatic experience that we all may be engaging with. So that's number one, is you want to prevent, try to prevent that re-exposure. I've been checking on the news all day because I want to know an update. Is he okay? Is he going to be okay? What's the latest word, right? And I think we all have that angst and that anxiety and that desire to know. But at this point in time, it's outside of our control. And the more that we engage with that news story and the news cycle, the more it reinforces our absence of control in this situation, which exacerbates distress. Number two, you want to process. So I had a very organic experience processing this event last night with my kids, real time. And so for the little ones, keep in mind that typically kids at around 4 start to conceptualize death and can start to appreciate that death is an important event. By 7, typically kids understand that death is permanent. And by 10, kids generally have a much more sophisticated understanding of death. The first question my kids asked when we're processing this is he going to die? And of course, at that moment in time, you can't really answer that. But it was a question that we had to engage with real time. For the little ones, it's very important to be genuine, use simple language, and be honest. But you don't have to give them all the graphic details, and you certainly want to make sure that you're anchoring it in their developmental level and using language that's going to be meaningful for them. One of the most, and then for adults, in terms of the processing, it's just as simple as seeking proximity to people that you care about, your friends, your family. Last night, I sought proximity to my wife, and we were going back and forth and just processing this unbelievable event, unbelievably tragic event that's unfolding real time on national TV. For the little ones, one of the most effective ways to process is going to be, for those of you who are spiritual, I understand not to impose any kind of spiritual beliefs or theological beliefs on anybody, but prayer is very, very powerful. Prayer is this part of processing is relinquishing control and recognizing that I don't have control. And prayer is a very meaningful way to kind of relinquish control. My 7-year-old was particularly upset and disturbed by the fact that this highly trained, incredible athlete could all of a sudden just fall to the ground and not be okay. And so last night, part of our processing process and experience was saying a prayer for Damar, for the Hamlin family, for his teammates, for the medical staff that were caring for him. And that certainly helped mitigate distress for me, but also my 7-year-old son as well. And then finally, we want to empower. So again, we have to recognize and try to redirect focus back to our locus of control. What happens with Mr. Hamlin is outside of the scope of our influence. And one of the best ways or most efficient ways to redirect back to our locus of control is to do so in honor of his current battle right now. He's in an intensive care unit. He's battling for his life. What are some ways that we can redirect back to our locus of control? How can we do something kind or meaningful for somebody here in our locus of control? Whether it's as simple as opening the door for somebody walking into the store, whether it's giving up that great parking spot right at the front entrance to the store, right? So somebody else can have it, or letting somebody else in traffic. Be intentional about being kind and caring for other people in a meaningful way, and do so thinking about the Hamlin family. And in doing so, that redirects your focus of attention back to your locus of control. It mitigates a lot of that sense of helplessness that we all feel right now. And it also is a great way to take a very, very tragic and negative experience at this moment in time and reframe it and in honor and in memory or thinking about what Mr. Hamlin's going through right now. So
Dr. Loper, thank you so much. That is great. I was going to say, I noticed on the national news that his charity that he had has gotten lots of money, because I think that's what people are trying to do. They're trying to find out something they can do. Yeah.
Absolutely. Really powerful for sure.
Yeah. I'm going to go back to Dr. Cryer. Dr. Cryer, so the question is, does anything put players, and I don't know if this is a question I'll ask you, and then maybe we'll go back to one of the other sports docs too. Does anything put players at a greater risk for cardiac arrest during an athletic event? Is there anything that is putting them at a greater risk? And with so many dangers associated, since this is associated with football and there's associated with other sports too, do physicians advise parents to continue letting their kids play? So I might go to one of the sports medicine docs for that, but I don't know what you think about greater risk for cardiac arrest.
Yeah, no, that's a great question. There are some entities out there that we certainly screen for and want to be aware of before athletes participate in sports, certainly sports that have a high degree of cardiovascular endurance required to compete. The most common things we try to ascertain a history, a lot of them are genetic. So we try to get a good family history and see, what parents or other family members might have. And, being aware of certain genetic conditions, such as a dilated cardiomyopathy or the hypertrophic cardiomyopathy, which is more so the thickening of the heart muscle. The dilated cardiomyopathy is the more traditional heart failure that we're aware of, with the weakening of the heart muscle. But the hypertrophic cardiomyopathy, where both these can be genetic, the hypertrophic cardiomyopathy is the thickening of the heart muscle that has the correlation or the association with the ventricular tachycardia and ventricular fibrillation. So being aware of that history, and finding that out ahead of time would certainly, I think push someone to do more testing, whether it's genetic testing or obtaining an echocardiogram or a cardiac MRI prior to, allowing that athlete to go through with high level, competition. Those are the main things that we typically screen for. There's other more rare entities. We usually will check EKGs on patients who are being screened for pre-participation and look for some of the more rare genetic things that can lead to abnormalities in the electrical conduction of the heart. Unfortunately, EKGs, especially in athletes, are known to be abnormal. They have these hyper healthy hearts, and that alone makes the EKG look different than the general population. So pre-participation screening is a little bit difficult outside of the known genetic things that we can test for with genetic testing. But if we have any question, we tend to put these patients on a treadmill with supervised exercise in a controlled setting to see how they do. We'll sometimes even do this with an ultrasound on their chest wall to make sure the heart is augmenting and doing what it needs to do to keep up with the athlete's performance.
I'm going to go to Dr. Foster. Dr. Foster, there's a question on here about with dangers associated with football. What would physicians say to parents as they continue to let their kids play sports? I mean, as parents, we worry. So, I know that Dr. Pryor was just talking about testing before you're playing and all that, but what would be your advice to parents?
Yeah, I mean, I think the first thing I'd like to sort of stress in this situation is what happened to Mr. Hamlin is incredibly rare. This is not something that we see very, very often, and it's obviously incredibly tragic and very sad. But this isn't a very common thing at all. I think in terms of letting your child decide to play sports, that's a very personal question. I think that's a question that each family kind of addresses on their own based on their comfort levels, their beliefs, and what level of risk they're comfortable with taking. Certainly, if you have questions and concerns involving your child's doctor in that conversation, can potentially be helpful. And as Dr. Cryer alluded, we do encourage all of our student athletes to come in and be seen for a pre-participation physical, so we can attempt to screen for things that may potentially put them at higher risk, not only from a heart perspective, but also from a bone or joint, lung, right? There are certainly plenty of things, unfortunately, that can happen on the field of play.
I'll go to Dr. Guy.
Again, I'd echo what Zoe said, but I think that the thing with regard to being parents can be a very lonely thing. You're in a different state. You send your kids away to college, and even with high schools, you're way up in the stands. I think that unfortunately, it varies on different levels. I mean, at the college level, we do EKGs and echoes, but I think that one of the things, as Zoe was saying, you can't screen for everything, and at the end of the day, it's a collision sport. As I explain to a lot of parents every year when their kids are in my office with injuries, every snap of the ball down a football field, everybody on that field has the opportunity to get hurt, and that's just the type of sport it is. And soccer and even basketball these days is a very aggressive sport, and kids get hurt. We do physicals on every kid and kids these days, and high schools and otherwise, and we screen a lot of kids out. And even at USC, we've disqualified a number of kids, kids with heart conditions that, as as our cardiologist was explaining, sometimes during the screening process we find things, and those things we do our best to find the things that may be obvious, but I think at the end of the day, you can't find them all. One of the things I think it may have gotten lost in the presentation last night is they kept saying that the parents were on the field. That's one of the things, especially at USC football and basketball. If any of our kids get hurt, we realize two things. Number one, the parents are usually in the stands, and or even worse, they're at home watching on TV. We're almost always nationally televised. And so you talk about a horrifying incident if your child gets hurt and they cut to commercial. So somebody in our group, fairly quickly, we always attend to the injury first, but somebody in our group calls the parents or brings the parents down when it's appropriate. But we respect the fact that parents are concerned, and we go let them know and communicate with the parents as quick as possible. You can imagine if they left his parents up in the stands and nobody went to talk to them. So I think the communication is super important, but yeah, it's rough being a parent these days. I mean, our kids are getting, I think everybody on this call knows, the kids are getting bigger, faster, and stronger. And so the collisions that occur now, the amount of force these kids take, I don't think the equipment's gotten bigger and faster. I mean, it's a high risk to play collision sports.
Yeah. Thank you, Dr. Guy. I'm going to go back to Dr. Cryer. I have several questions for him. Dr. Cryer, so the question is related to, are there certain signs of cardiac distress that, parents and anybody should be watching for during a game or practice?
Well, certainly, family, friends, coaches want to pay attention to, signs or symptoms that a player may be demonstrating that may warrant further evaluation. So things like chest pain, palpitations, lightheadedness, and dizziness, passing out, especially passing out with exertion, would certainly warrant, good, evaluation by a doctor, and it certainly would include cardiac evaluation. If a player who previously had great cardiovascular endurance all of a sudden is struggling to keep up with routine physical exertion and falling behind teammates all of a sudden, that would be a warning sign as well, that maybe something is going on, and that may be a player that we want to look at, pull aside, and just get a good history and do a physical on and determine if an additional testing is needed at that time.
There's a question about the difference between cardiac arrest, a heart attack, and heart failure. And I know those are all three kind of complicated things, but is there sort of a short version of that you can give? Heart arrest, cardiac arrest, heart attack, and heart failure.
Yeah, of course. And first, before Dr. Guy had mentioned this, but largely, even with screening, there are things that are going to happen. We're not going to be able to find everything, and there is going to be some intrinsic risk with anything we do. Fortunately, these risks are extremely small. I do want to make that point to the public. This is a very small risk. It's just it's something dramatic, and it's very scary. And we as a medical community are working to get better. And hopefully, with every passing year, we get more accurate in catching these things before they happen. But it's a great question you ask. I get it very frequently. So what is cardiac arrest? Cardiac arrest, in its simplest form, is the heart stopping, loss of a pulse, and usually with that comes the rest of the respiratory cycle. So stop breathing, no pulse. Sometimes the breathing is what stops first, and then with lack of oxygen and other things, the pulse then goes away. Heart failure is more a symptom of the heart not functioning very well as a pump. So the heart is no longer moving blood very well. and you can get signs and symptoms of the congestion and low output that sometimes happens. I mean, its most mild form, some patients may just have a little bit of swelling or shortness of breath. In its more severe forms, the heart failure could lead to some other organs being injured, such as the kidneys, the lungs, the liver, and what have you. And then lastly, a heart attack. A heart attack is an entity where there is usually abrupt loss of oxygenated blood flow to an area of the heart muscle, and that is traditionally, as for people, is delivered by their coronary arteries. So if there's loss of blood flow to a coronary artery, most traditionally from some sort of plaque rupture in an area of atherosclerosis or erosion in an artery, that allows either occlusion or subtotal occlusion of that artery, can lead to ischemia, and with time, infarction, which is the injury. The ischemia is the injury to the muscle, and the infarction would be the damage to the heart muscle if it's left untreated.
Yeah, thank you. I see that Tom had asked a question about, and I don't know if I'm gonna say it right, commotio cordis.
Yeah, the
And the
commotio cordis, yeah.
Yeah. So I know that that's some of the conversation that's being had in some of the articles. So can you just kind of tell us about, and I guess there was a question about whether it's really rare, kind of what that is, and what exactly that is.
Yeah, so this is a condition. If there's an impact to the chest wall area, and as mentioned in the question on the chat, the question was, does it have to be a hard hit, or is it more about the timing? And to answer that question, it's the hit has to be hard enough to affect the heart, but it does not have to be a very large hit. It's not about the force of the impact. It's more about the timing. If that impact occurs in the chest wall at a specific time of the electrical activity of the heart, it can this would be a very vulnerable time in that electrical activity of the heart. Luckily, it's a very short window, so there is some bad luck, unfortunately, associated with this. But if that were to happen, that can trigger the heart to go into an abnormal heart rhythm, such as the things I mentioned earlier, the ventricular tachycardias and ventricular fibrillations. It tends to be in children, adolescent age, with an impact to the chest, such as a baseball or a tennis ball. Children tend to have less tissue between the outside environment and where their heart lies. But certainly a young, thinner athlete would be at risk for this as well.
Okay, so there's a question from a viewer saying, and I'm not sure, I'll make sure I understand this. It says, does a hyper heart give the person a greater chance of cardiac arrest, a heart attack, heart failure?
Cardiomyopathy?
Yeah.
It does. In diagnosis of this condition, in addition to trying to treat symptoms of heart failure, such as the shortness of breath and stuff, a very important focus for us as cardiologists is assessing the risk for sudden cardiac death. It's probably the most important thing we can do for that patient is identifying somebody with this condition who may be high enough risk to even go ahead and place an implantable cardiac defibrillator in ahead of time. It's not unusual for us to have patients in our clinic that we follow, and we pull the trigger eventually to place this device, either because they demonstrated short bursts of ventricular tachycardia, or they have a high degree of scar in their heart, or have had some sort of unexplained passing out episode in the past. So yeah, that is the hypertrophic cardiomyopathy itself does unfortunately bring with it the risk of sudden cardiac death.
All right, I'm going to go back to Dr. Loper for a second. Dr. Loper, so, there's some questions about parents and, allowing your child to play and the whole conversation about that. So what would you say to parents who are making that decision as they think about, their family unit and how to talk about that?
Yeah, that's a really great question. And it's interesting you ask it, because I just have a feeling that I'm going to encounter it here soon enough with my kids, who seem to really enjoy contact sports like football. So, you really want to make sure that you're, again, anchoring that conversation in the child's developmental age and stage. As a parent, you're really responsible for knowing the facts. And so at which time there becomes a concern where you have any kind of concern about, participation, your child's participation in sports, the best thing you can do is seek proximity to the expert. Go talk to the experts and ask them for some support. Learn the facts, know the facts. And then once you have that foundation of facts, then you can engage with your child in a meaningful way. Again, anchoring it in developmental age and stage. If they're an adolescent, it is going to be important to try to respect their autonomy. But as a parent, ultimately the buck stops with you. It is your responsibility. If after you learn the facts and you have any concerns or issues with your child participating in sports, it is your right to go ahead and lay down the law and say it's not happening. And so, but yeah, it is. I'm sure a very, very difficult process, and one where you want to make sure that you're respecting your child's autonomy and respecting your child's choice, while at the same time ensuring you have the facts to keep them safe.
Right. So that's that last question. I was going to say, I'm going to go back to all of our spokespersons for final thoughts. Dr. Loper, you have any other final thoughts?
Only thoughts are, thoughts and prayers for the Hamlin family and for the Buffalo Bills and his teammates and his friends in the inner circle for sure.
Thank you. Dr. Foster.
I would certainly echo Dr. Loper's thoughts there as well. And I would encourage parents to reach out to their child's physician if they have questions or concerns, and certainly to make sure that their child is up to date on screenings and has a necessary pre-participation physical before starting in sports.
Dr. Guy.
I agree with Dr. Loper and Dr. Foster. I mean, I think that being informed as much as you can as a parent and is doing your due diligence with your kids playing sports, and when you have questions to identify an expert in that field and find out and read more about it. I think those things are critical. I think you'll find that one of the big problems also is not only witnessing somebody getting hurt, but also what happens when you get hurt and whether you want to go back again. That we face that one almost every day, and that's another discussion. So is return to play. After having a big injury, do you want to go back and play again? And so Dr. Loper's role is huge in that population and growing. So yeah, I think that it's important for us all to let this play out, because all the things that we talked about and Dr. Cryer explained, which is wonderful. I think that there's going to be more that comes out about what exactly happened and what the reason was, and all these things are possible, but it'll be really interesting to see how this goes. And yeah, our hearts out to all the family and the Bills and everybody. I think it's an amazing, difficult thing to go through as anybody watching, all the way to the physicians doing it and the athletic trainer doing the care. So we applaud the care that he got on TV. I think it's a scary thing for everybody.
All right, Dr. Cryer. All right, Dr. Cryer, final thoughts?
Yeah, just thinking about, Mr. Hamlin and his family. They're going through the most difficult time right now, and we'll be thinking of them. I do want to thank the comments from our other physicians, and it's really encouraging to know, from Dr. Foster and Dr. Guy, that there is preparedness, and this is part of their training, and part of the reason they're there is to be ready to go in case something like this happens in facilities like the University of South Carolina. I do want to reiterate, this is sudden cardiac death, especially on the field of play, is extremely rare. It's traumatic, and this is a tough thing that a lot of people witnessed. But again, it's extremely rare, and I don't think it should, be in the back of everybody's mind anytime they think of playing sports. This is dramatic, and it's a tough time that everybody that saw this is going through, but especially Mr. Hamlin and his family. So we'll move forward. We'll see what more information comes out, and we'll go from there.
Okay, thank you. Thank you. I want to thank all of our physicians on behalf of Prisma Health. We wanted to bring them on to share their expert opinions. Of course, as I said earlier, that all of them are not involved in the specific case, but they wanted to offer some information to our community. as we always do at Prisma Health. We want to thank our media partners for helping us share that information with the community and those who are on our Facebook page. If you have additional questions, please leave them on our Facebook page and we will try to answer them. Thanks to all, and everyone have a great day.